Our next session is going to be on identifying autism earlier, moving beyond ADEP. We have Maggie Gons that's going to present for us today. Maggie is the Early Childhood Professional Development Manager in the Center for the Young Child at Ocala. She develops, coordinates, manages, and consults on a variety of early childhood projects related to the earlier identification of autism, evidence-based interventions, and program improvement. Maggie also provides coaching to inclusion support specialists for Ocala's new Early Childhood Center for Excellence for Inclusion. She is a certified play project consultant, play project supervisor, and speech-language pathologist for over 20 years of pediatric experience. In her free time, Maggie enjoys distance running and outdoor activities with the Adaptive Sports Connection. I will now turn it over to Maggie.
Thank you. Oh, that's way better. Okay. Well, thank you guys so much for the warm welcome. This is a hybrid session, so there is a camera over here. But if you can't hear me at any point, please let me know. Again, thank you so much for the introduction. It's kind of weird, like Misty said, to hear people talk about you in the third person. Hopefully you've heard of Ocala, but today we're going to talk about ADEP. That was what I was asked to talk about, but we're also going to go beyond ADEP and talk about identifying autism earlier. So if you're not familiar with Ocala, to sharing resources, providing training and technical assistance, and consulting and collaborating to impact the development of young children, not just in early intervention, but all young children. And we really work to promote a strong start for young children and their families, helping chart that positive course for a lifetime of learning, growth, and opportunities. So today, I'm going to provide a brief overview of ADEP and what it is, review the current ADEP data, so the data we have to date from counties that have submitted information to us, talk about the key principles of it, and talk about some ID early learning pathways and resources for teams that maybe don't have an ADEP team or want to move towards that. So hopefully today you'll walk away able to restate the key principles of ADEP, describe the different learning pathways for ID early for autism spectrum disorder, and identify potential resources to expand professional skills related to earlier identification. So, just a little bit of backstory. If you're not familiar with ADEP, funding and support for the project comes through a contract with the Department of Children and Youth, Ohio Early Intervention specifically, to address several areas related to earlier identification, intervention, and personnel professional development. Previously, before it was the Department of Children and Youth, it was the Ohio Department of Developmental Disabilities. And we operate on a 2-year schedule where we're looking at fiscal year 2023 to 2025. So we are approaching the end of our first year and we're approaching the second year of our contract. And we are specifically at Ocala contracted to work on earlier identification. So ID early, and that includes ADEP. Autism Diagnosis Education Project is the full name for ADEP, the acronym. It was launched in 2008, and then there were various expansion projects that happened in 2010 and 2015. For those of you that know Dr. Dubey, who was at Dayton Children's Hospital, he was instrumental in launching ADEP. He recently retired. So if you did not know that, he is now retired, but he was instrumental in bringing this to Ohio and getting it going. It's really, the project itself is a unique community-based diagnostic partnership between Ohio Early Intervention intervention teams and local medical professionals. So we are working across systems to support families. Some of the partners that help support this project provide input, provide guidance. Certainly, we talk regularly with Ohio Early Intervention partners. We share information with them. They help provide funding and supports, but they also provide guidance as to following the EI practices. We also work closely with Akron Children's Hospital, specifically the Family Child Learning Center. That is transitioning as the Family and Child Learning Center is changing their organization. But we work closely with Dr. Jessica Foster, who is our medical partner and guidance for our medical professionals. She's a developmental behavioral pediatrician at Akron Children's, and she offers insight from that clinical lens and that medical community viewpoint. And then certainly we have our partners within Ocali. So the goals of ADEP have been to increase early and timely access to a standardized, comprehensive diagnostic evaluation for children with concerns in language and social development, which includes autism spectrum disorder. And to provide families a pathway to timely diagnosis and targeted early interventions and services. And at the time that ADEP was launched, there were huge issues with wait lists across the nation, across the state. We know there still exist huge wait lists across the nation, across the state. It is not just an Ohio-specific problem, it is a nationwide problem accessing physicians to provide the resource and do the evaluations. So in 2012 and 2015, those goals were expanded so that we were really focusing on reducing the time from that a family has that initial concern to diagnosis. So on average, back then, a family was maybe having concerns and they would wait 18 months to get a diagnosis for autism or rule in or rule out a diagnosis of autism. So our goal was to make that less than 9 months. Our goal was also to reduce the time from initial contact with Ohio EI, and at that point it was Help Me Grow, to diagnosis to within 90 days. So once the family reached out to Help Me Grow, it would only take 90 days to get to a diagnosis with a medical partner through ADEP. And to lower the age of diagnosis from 36 months of age to 30 months. So in 2018, we took a look, and at that point in time, kids in general were waiting about 9 months from the first concern to diagnosis. Nationwide, families were waiting about 34 months. The average age of diagnosis at that point was 30 months within ADEP. Nationwide, it's 46 months. Currently, these numbers are pretty similar. Nationwide, kids are still on average getting diagnosed with autism at age 4 or older nationally. And on average, we do see families have first concerns, but they're not getting diagnosed right away, but that's not necessarily because they've been in EI. A lot of times it's because they haven't even gotten to EI yet. So one of the challenges we've seen over the life course of this project that's been going on for a long time has been the recruitment and maintenance of medical partnerships. As Misty and was talking about before, there are real life workforce issues. We know there is a shortage of pediatric medical professionals. There's also a shortage of physicians across the state. Ohio is actually really unique when you talk to other states in that we have about 8 diagnostic centers for young children. Some states have 0. So when you go and talk to other states and they are talking about, oh, we don't have any developmental behavioral pediatricians in the entire state. And Ohio has at least 8, maybe more. When you think about the university, when you think about Cincinnati Children's, Columbus is nationwide, Rainbow Children's, and then now we have Toledo, which is part of Nationwide Children's as well, right? So we have a lot more resources than we realize. Still not enough, still not meeting the demand, but that has been a real challenge, is finding a medical professional who has time in their schedule to collaborate with our EI teams to serve these children and families. The other challenge is providing that professional training and expertise to our early intervention teams. So we have a field of a lot of young new professionals, and the ADEP requires a lot of skill and experience in working with children who we suspect have autism, because the testing and the tools we use are a little more complex. And so providing that professional expertise and training can be challenging when we're replenishing the field and replacing as people leave the field. As all things, cross-system coordination can be tricky, right? We're speaking different languages, using different words. And then just over time, we do see some drift from fidelity. We start seeing people doing their own thing that maybe looks differently from place to place. And we sometimes hear and get questions about, well, what's happening here? So that has been a challenge. And then certainly during the pandemic, we realized that a reliance on one tool that requires only in-person administration is a real challenge. If we can't use the tool because it requires us to be in person, that kind of stops us cold. So how can we look at, adding to our toolbox, expanding our skills, and thinking about using different resources? So overall, the strengths of this program have been that families have access to a local, timely, standardized, comprehensive evaluation as part of the early intervention process. So, and now they can also add that early childhood mental health piece, right? A lot of times when we're thinking about a child, have concerns about their social emotional development, we maybe have concerns about autism, we need to also be considering the mental health of the child and family, because trauma and autism can look really similar. And a lot of times in little people, we don't know, right? And we do know a lot of times children with autism maybe are more susceptible to becoming traumatized because their sensory differences make them more potentially sensitive to different things in their environment. The other strength of ADEP is that reduced wait time. We know children and families who are in that EI process are moving quickly through this evaluation and diagnostic journey compared with people outside of ADEP going through the other channels that are maybe available to them. And it is a coordinated process for collaboration across systems. When there are good partnerships and strong relationships with that medical partner, there's communication happening back and forth. There's a smooth process. They're able to talk and connect with each other, which really builds that connection. So when we took a look at the statewide data, and this was year to date, we kind of relaunched the survey back in 2022. So when we asked who was first concerned, which person kind of brought up those concerns about autism first, overwhelmingly, families first expressed concerns to the early intervention professional about autism themselves. I will say this is a shift. When ADEP first started, families weren't necessarily bringing up concerns about autism. The early intervention professional or the medical partner was bringing up those concerns. I think there's a lot more awareness and acceptance about autism as a whole from now compared to 2008. Also, we know there's definitely an increased prevalence. There's a lot more information out there. But more often, families are coming to early intervention already concerned, already having some feelings that maybe this is something they need to look into. And so the professional responsibility about bringing autism up first isn't necessarily falling on early interventionists all the time, but it still does. And it does still fall within our realm of things we have to work on. Second, that person who might be first concerned is that early intervention professional. And so they are looking for resources and tools to have that tough conversation and discuss maybe their concerns with a family. Not far behind is the medical professional who might express concerns, and then childcare or other places that may express concerns. Within the ADEP project, so again, this is just counties participating in ADEP, we find that about 40% of counties will do an autism screening before they move forward with a complete autism evaluation. But about 59% of the time, teams are not conducting any autism screening tool. And when we look at the research nationwide, there is a shift towards kind of doing this tiered approach to autism identification. So in instances where children have very indicators indicators and meet the criteria for autism diagnosis, in some communities, they've decided that they can use some kind of more intense level 2 types of screeners to determine or rule in or rule out autism versus doing the complete autism evaluation with an ADOS. So that's something we've been looking into. What are some tools and what are some resources we can provide professionals that are able to diagnose that maybe aren't a full evaluation piece? When we look at the gender of children within ADEP that are being evaluated, about 70% of the kids are male, which is on trend with what we see across the nation, and about 27% 28% of the children are female. One thing that we do know is that the tools and the diagnostic resources that are available to us are geared towards boys. And so a lot of times there are girls that we suspect maybe will get that diagnosis, but they won't be identified until later when they actually meet those criteria. And that's just a limitation that exists in the clinical world that a lot of professionals are aware of, but it's really frustrating to families and it's really frustrating to professionals because maybe you've put yourself out there, you've said you're concerned, and then it comes back, well, we're not sure, or we're going to give you a different name or different diagnosis. And so that just is something that we do work within the confines of when we're talking about really young children. So when we looked at the ages and the wait times, the average age of a child at the time of the autism assessment within ADEP, again, was 30.36 months. So again, on average, kids were getting diagnosed by 30 months of age. The average age of the child when the family first had concerns, though, was 20.75 months. So even though families were first concerned at 20 months, they weren't making it to EI, right? So that speaks to a broader, like, how can we get them to you guys sooner to get intervention even earlier? Because families were concerned, 10 months before they even got to maybe early intervention to get that assessment. But once they were in EI and they're going through that evaluation and assessment process, they were waiting on average about 42 days from that time that the EI professional conducted an autism evaluation and a comprehensive evaluation for that second follow-up appointment with a medical partner to either rule in or rule out autism as a diagnosis. So there were some outliers and some weird things happen where, some teams, the appointments were flipped, and some instances we had different things happening. But on average, it was about 42 days compared to what we've been hearing, across the state about some of the wait times, especially for kids above 3. It's a year plus for some of those evaluations through our diagnostic centers. So a shorter journey and shorter pathway than some other families may experience. So one of the things that I thought it would be good to review with everyone is sometimes we hear ADEP, we think about ADEP, and you think one thing and maybe it's not that thing. So I thought it would be a good opportunity to take those key principles of early intervention and take a look at what it looks like versus what it doesn't look like. And this is a technical assistance guidance document. Some of you have been attending the regional meetings that we've been hosting. And so I apologize if you've already seen this and have gone through this. But really the key principles were divided up into several areas. One, bringing up the topic of autism, because when this was developed, we had a lot of professionals who didn't feel comfortable talking about it and bringing up those concerns. And so empowering professionals to feel more comfortable to have those conversations. Looking at parent and caregiver involvement, the use and the role of the ADOS-2, which is the assessment tool we provide resource and technical assistance on, the diagnostic appointment itself with the medical partner, that relationship between EI team and medical partner, that sharing of information that needs to take place within teams, the submitting of data, which is what we use to kind of report back to our funding partners, and overall team engagement. So in terms of bringing up the topic of autism, it really needs to be a standard part of the process. All families are asked the same question. It's just a standard part of that process so that it's not creating in that professional that anxiety of, do I ask, do I not ask? If it's just a standard part of the process, you're taking that professional burden off of yourself. You're fulfilling your professional liability or responsibility of bringing that up and not missing any families. I don't know about you, but I definitely have been in the field long enough where there are situations and teaming moments where we said, I don't know, I can't bring it up. I don't feel comfortable. How will they react? Well, it wasn't my job to decide that, right? Like reflecting now, I can say, oh my gosh, I can't believe I didn't share my concern because I was worried about how this family would react. It's not my job to keep that from them. It is my job to say, I have concerns. This is why I'm obligated to share that with you. And I think that that's been a big transition of our field, that kind of change and that shift, but just kind of making that a standard process. Using your good EI tools, being responsive and caring and understanding, respecting that this is a difficult topic and it may come with emotion and concern or anger or frustration, so many feelings. But really, we want to make sure everyone on the team is equipped to have that conversation, not just one person, because what we find is if that one person leaves the team, that knowledge and expertise went away too, right? So we want everyone to feel comfortable and have the tools. And can we be identifying those regional resources, right, that we can connect families with right away? Are there family support networks? Are there family resources and tools and people that we can connect them with? Because we know early childhood mental health is important, and families of children with autism experience much higher mental health concerns and stressors than other families. And so we want to connect them early with other families and resources. In terms of that parent caregiver involvement, just explaining the steps and the parts of the process when it comes to an autism diagnosis process. So within the ADEP project itself, or if you have a family that's going through a diagnostic process through one of an external agency or a telehealth agency, doing our best to kind of prepare them for what's going to happen each stage of the game. Are there 5 appointments? Are there 3 appointments? Are they going to see, an audiologist? Are they going to see a neurologist? Are they going to have blood work done? And it could look different for every single family and every single child. And you may think you understand the system, and then the system will change, right? Because they're seeing different people, but just kind of helping families as best you can prepare for what's they're embarking on, and maybe explaining anything that's difficult to understand, or, all that jargon that comes back. And, doing our best to reduce that jargon or interpret that jargon. Within ADEP, offering to join the family with their medical partner. That has been a huge thing for many families. It's one of the things we hear back from teams, is that when a professional can join the family at that medical appointment, it is so powerful to have someone there, a support person, someone that can hear. How many of you have been in a medical appointment and not heard anything that the doctor told you, right? Especially in a traumatic moment or a really tense moment where you didn't hear half of what they told you, right? So having someone there with you can be really powerful and supporting. And also you're able to then connect families and support them with resources. So the next area is really the role and the use of the ADOS-2. So within ADEP, teams or professionals are trained to administer the ADOS-2, specifically the toddler module. Sometimes they use the preschool module. It is a standardized assessment. It is, in general, the one that is most often used to determine autism in collaboration and in tandem with other resources and tools. One tool does not equal a diagnosis. Autism is an objective observation diagnosis. And so it's not like you get a score of X, then that means Y. It is a more complex assessment than that. And so it really needs to be done using the right module, because there's several different versions. It also needs to be used in combination with other assessments. So as part of EI, you're already doing a Bailey or Battelle to just look at general development. Thinking about EI rule changes, if that's only happening maybe upon entry and it's been 2 or 3 years, we're going to need a new one, right? We can't use old assessments, especially when we're talking about little kids, 6 months, huge things change. So thinking about a recent assessment of overall general development. In some instances, teams will complete the routines-based interview and share that with their medical partner. And then thinking about any other information you could gather, right? If you have concerns about communication, it might be worthwhile to add some communication assessments specifically to this to make it a little more robust. If the child has sensory differences or sensory concerns, can you bring that other team member in to add that information? Because all of those things can be really important tools to supplement what you find using the ADOS. But really, we don't want it to be the only tool, right? We can't just send the score sheet on and say, okay, doctor, decide what's happening. But once you have all that information, you send it to the medical partner so that they interpret and share the results with the family at the diagnostic appointment. That information doesn't go directly to the family at that point in time because it hasn't been interpreted. It's just information that's been gathered and collected so that the professional who does make that determination is able to do that with the family at that visit. At that diagnostic appointment, it's going to look like all the information is included, and they're going to take that clinical observation from our EI team. They're going to take that formal assessment. They're going to look at the diagnostic and statistical manual criteria, the DSM-5, which outlines what the criteria are. And then they are going to utilize the knowledge and expertise of their entire EI team to inform whether they think it's autism, whether they think it's not autism, or if they say, you know what, this child has really complex needs and I'm not sure. I want to refer them on to a developmental behavioral pediatrician, or, this child also has seizures and maybe epilepsy, and they need to have some additional blood work done, some maybe neurology work done. So that does happen, right? Like, you don't have to say yes or no now. You can defer to an even more advanced professional. And if it's not in your wheelhouse, right, you refer on for additional resources. But really thinking about utilizing that whole team's knowledge and expertise. In terms of the diagnostic appointment, the medical partner should be tailoring their intervention recommendations to the child and family, presenting all the evidence-based options, which also aligns with our EI team, right? Presenting all of the options. If you have a child that's going through an external site, maybe it's helping filter through the recommendations that the family gets back, right? So maybe it's lots and lots of things and helping them understand what you can access here and now, what's a priority for them here and now, what resources are going to align with how they want to see intervention work. What we don't want to see is a physician writing a script for XYZ and handing it to the family, and then the family going off and saying, I need this that's in this script. That's what we want to avoid. So it's really tailored to that child, that family, your community, and what resources are actually available in the community. Because how frustrating is it when you're told to do something and you go to your community and that something isn't available? It's really frustrating. And so we know we want to help families understand what it is that's in their community, what it is we can explore, how we can support accessing things. We also want to make sure we're imparting hope and allowing families to grieve, right? This is a big thing. It's hard to accept a diagnosis for your child if that's what happens. And so allowing that process, allowing that space, providing those supports. Maybe it's bringing that early childhood mental health consultant in to support the family at some point. And as best we can, using that clear, plain language with families. So then thinking about that relationship between the EI team member and medical partner. Again, it's that ongoing, consistent two-way communication. We know physicians and nurse practitioners are busy people, but we want to have that communication. If it's not with them, maybe there's an office manager that communicates with us, or a nurse that can communicate and then relay that information. But we want to be able to build rapport and feel comfortable to address concerns and questions, right? So if a team is not comfortable with what their medical partner is doing or doesn't agree, they need to have open lines of communication to say, hey, you know what? We're not on the same page. Let's get on the same page. Or we've had some physicians say, you know what, I don't need you to send me the RBI. I don't need you to send me the IFSP. And so understanding that if they don't need that information from you, they won't send it, right? But being able to communicate that back and forth. And then also seeking time together to debrief, right? So when they have a tough case, or when they aren't in agreement, or, there are times where they have differing opinions. They have time to talk about it and figure out why, one thing was ruled in or one thing was ruled out. The next section is thinking about sharing information, right? So they need to be able to discuss the information prior to and following the appointment. Ensure information arrives and is received. So, if the doctor doesn't have the information before they see the family, it's not going to go well. So there's a lot of coordination that has to happen within the EI team for that physician, especially when we look at, some of those wait lists and times getting in with a doctor. So, we've provided some guidance to teams that, if they're not going to see the medical partner for like 6 months, wait, don't do your assessment. because by the time they see them, it's going to be outdated. So, timing is everything in this world. And we want to make sure we're timing it so that there isn't a huge lag time. And then just following up to see, did the family get a final report or from their medical partner? Is there any information that you guys need back as an early intervention team? And then that production of a high quality report. So making sure as an early intervention team, you're providing high quality observations that are objective and informative, that provide some information for external partners as far as what you're noticing related to that child's development and what it looks like developmentally. Using that formal and informal observations, those actual objective observations that you've made and tools that you've used, and thinking about how they're grounded in developmental milestones. So then in terms of data, we do collect data from our ADEP teams. We ask them to submit consistently and regularly. And so we've asked them to identify a point person, complete all the questions. And what we've started doing since we've updated our data is that we can give teams some real-time feedback about what they're doing. That being said, some teams see and evaluate more children than others, so that data isn't necessarily at a point where it's helpful. If you've only evaluated one child, that data isn't very helpful because it's that one child, and it's also very identifiable. So we want to make sure we're at thresholds where we can't look at that data and be identifying which children we're talking about. So we want to be really careful about what we're sharing back with teams. But we want them to take this data and be able to use it to inform their practices and guide them, and thinking about how they can improve and work forward and make changes and adapt. Because in the past, before we updated our data, teams weren't able to access it. It was going to a university somewhere in a hub, and it was going in this secure place, and no one could touch it. And we didn't know who had control. We didn't know who was accessing it. And so now teams are able to get real-time feedback about, hey, these are the numbers of kids we've seen that you've seen. Is that accurate? Is it not accurate? Teams are in more real time able to understand and see what that map looks like for them. And the last area we have is that overall team engagement. So we want teams to attend and engage in ADEP-specific webinars, meetings, trainings. There's been a lot of content given through over the years for teams specifically on earlier identification. And so we want teams to continue engaging in that. Research is always changing when it comes to early identification. And so we want teams to have the most up-to-date information and resources and tools available. So we provide that and try and provide that regularly to teams. We also want teams to be responsive and engaged. So if I have a question or someone from the state asks me something, I can reach out and know that someone's going to follow back up with me and respond and answer that question. So just that back and forth engagement. We also want to make sure we're looking ahead for teams, right? That they ensure their new professionals are equipped and trained, right? As you're rebuilding your team or anticipating someone leaving, maybe because they're retiring or they've moved to a new position, we want to make sure we have people on deck that are trained and supported in doing this work. We also want them to be their medical partners and our professionals committed to improving an earlier identification. So while we can't say to a medical partner, I need you to take this course, because they're not our staff, and they are highly qualified professionals, we hope that they're engaging with resources in their communities that provide them professional development to continue enhancing and building their knowledge base around earlier identification. So that's just ADEP. But what we know is that right now we have maybe, I think at last check, maybe about 30 counties that participate in ADEP. We have 88 counties, so that's not every county, right? This isn't, that's only a small portion of the state. So we recognize that there's a lot of information and resources and supports that other professionals need access to, that maybe they don't have a full-scale team or medical partner to do ADEP and participate in that specific diagnostic process, but we can still be identifying children earlier and getting them specific interventions earlier. So I wanted to talk about Ocala Center for the Young Child. We have a resource called Education Station. And there is a specific resource on that page for professionals called ID Early. This resource is divided into several different levels. We have 4 levels, and I'm going to break that down a little bit further and just kind of identify some resources for everyone that can help, either if you're a new professional or you're new to early intervention versus if you're a seasoned professional and you have a well-oiled machine. So in terms of getting started, at level 1, we have a free online resource called Many Faces of Autism that's approved for DoDD credit and early intervention credit. And then there's also an autism internet module, which is free, which is specifically a guide for early interventionists. That one itself is OKRA approved. So if you know someone who is looking for OKRA credit, that is approved. But those are kind of just beginning, getting started, want to know a little bit more. But if you're ready to dig deeper, and for teams that are maybe thinking about ADEP or want to do some maybe enhanced screening within their programs, some of these resources at level 2 would be a good foundation. So there are 4 modules at this level 2. And these 4 modules were built and developed taking all of the ADEP webinars that were given over the years to all of our ADEP teams and decided that, you know what, maybe other professionals should hear this information too. It shouldn't just be ADEP. Everyone needs access to this information. So within these 4 modules, the topics are early indicators for autism spectrum disorder and tools to assist with early identification. And that's going to talk about some screening tools that are available out there and different checklists that we can be using earlier. Talking with families about your concerns related to autism specifically. Supporting caregivers through the diagnostic journey, right? Because we know it can take lots of different paths. Not everyone's going through ADEP. And so this is a great resource tool to use. It also incorporates some of the Charting the Life course resources to think about how we can help support families through that. And then the last module is diagnostic criteria. What is in the DSM-5? And then how can we communicate and collaborate with those external professionals, whether it's our medical partner or maybe it's someone in a diagnostic center or an outpatient clinic, but just thinking about how can we work across systems to communicate and collaborate to support that family that's having all of these different professionals involved. So all of these resources are really good resources to build a strong foundation for your team or your professionals on your team who are looking to do maybe some screening specifically related to autism. Maybe they're going to become an ADOS assessor, or they're going to be more involved or just want to expand their skills. They're all approved for DoDD credit and they're free and online. And then at that 3rd level, we actually have a resource on the tele-ASD PEDS. This is a more intense, in-depth screening tool. It's a level 2 screening tool, but in some instances and in some states, even in hospital systems, medical professionals will use this tool to actually rule in or rule out diagnosis. If you're familiar with a resource called As You Are, it's a telehealth diagnosis resource across the nation. It's in all 50 states, here in Ohio as well. This is one of the tools that they will use to rule in or rule out autism in those telehealth appointments. So it is a telehealth design tool. It can be used in person. It does have some specific criteria that align with the ADOS. That webinar was recorded. It's available on the Ohio Early Intervention website. It's approved for DoDD credit. It's also approved for physician credit. So if you have a physician in your community who wants to know more about early intervention, there's a resource that's approved for medical credits on EI on the website. There's also this resource on the website. And also that Many Faces of Autism course is approved for medical credit as well. So all of those resources are available to medical professionals in your community who maybe would get the kids to EI quicker for you if they had this information. And then we hosted some virtual screening trainings November through January of this year, and we're looking at taking those recordings and making those available online as well. We know not everyone has time at certain times of the day to attend all of the trainings, but it's worthwhile information. And what I can share is there are a lot of autism screening tools. There are many different levels of autism screening tools. There are autism checklists. And so it's complicated, and there's new research changing all the time about what tools we have for young children. But what we know is there are a lot of resources that can be available. And we are also exploring our lending library and providing some of those screening tools and adding those screening tools to our lending library. So for example, there's one called the ADEP, which is a rapid test out of Boston. And we are looking at adding that tool into our toolkit, into our lending library, so teams could check it out, see it. Is this something we want to purchase? Is it not something we want to purchase? And you could check it out first. Same thing, we're exploring the STAT, which is used in other states. And that is also something we are looking at adding to our lending library for teams, in addition to the ones that are online and free. So then at level 4, we have inspire, change, and build a team. And this is really where our ADEP teams are, but it also might be where you have an you have a team together who wants to work on early identification. Maybe you don't have ADEP, but you're going to do some more high-level screenings so that when you send your information or share a referral, you're able to share more robust information with that agency that you're making the referral to. So maybe you've completed a tele-ASD PEDS or a READ-A-T or one of those more in-depth screening tools to give families more information and to help expedite or ease that process to that next partner in that stage. It's also where if you have an existing team or you're thinking about, gosh, our region doesn't have anything. We're not sure what to do, or we've got so many people and I don't know how to coordinate it. We can help provide that quality improvement process and support. So, we can pull together and help you pull together people in your region or people in your area to have and facilitate some discussion about what we can do. Because like I said, there is a medical partner shortage. And so, where we used to focus on our county, maybe we need to think more largely about pulling resources across regions, or in our regions that have a lot of resources, how can we coordinate between the many different partners and agencies to work together? Because some of our community hospitals and diagnostic centers are being flooded with referrals, and they're even thinking about how can we be creative? How can we work more collaboratively? For those of us that have been in the field a long time, the conversations are a little bit different than they were maybe in 2008. And so we want to think about how can we be better partners and support one another in the workforce? And so that's one of those next levels that we can offer and provide. So the other resource that I'll highlight is our Early Childhood Inclusion Center of Excellence, which is our newest center at Ocala. And just some of the things that are available to families and professionals for those of you that are in early intervention or for families out there. So within this new center, they offer statewide coordination and guidance. They offer professional development and training to early care and education professionals. So they're specifically going out and supporting people in early care and education, in childcare centers, and providing professional development and training to those childcare professionals on supporting young children in their care. They're providing coaching and technical assistance to those childcare and early care and education professionals to support children staying in that childcare setting that they're already in. They're also providing resources and tools. So we've been able to pull together a lot of early childhood specific resources into the Ocala Lending Library and we've added a whole bunch of other things that families and professionals can borrow for their setting. So more things are being added regularly, but there is a wealth of resources that you as professionals and families that you're working with can access and borrow from our lending library to support families either in where the child is going for childcare, where they are in their home, but any setting that they need that support. And then again, they're providing evaluation and continuous improvement at a programmatic level. So they're taking a look at early childhood inclusion indicators in childcare settings and early care and education centers, and reviewing with administrators and teams how we can be better at including children with needs in the setting that we're working in. So I want to pause because I feel like I've been talking a lot and there might be some questions. So I just want to give space and see if there's any questions related to ADEP or any specific information. I have my data hot and handy. So if you want to know numbers, I can do that too. Yeah. Yeah.
For a medical partner to become part of the ADEP. I'm done.
So I can repeat. So you're looking for a list of criteria for a medical partner to become an ADEP partner. So I think this is tricky because we have some teams who partner with a developmental behavioral pediatrician, right? So up until when Dr. Dewey retired, he was a medical partner for some teams. Dr. Jessica Foster was a medical partner for some teams. That being said, those people aren't everywhere. They're hard to find. We also have some teams who partner with a pediatrician, right, who has a passion and an interest. And maybe we've given them some extra tools to feel more comfortable and confident in this area. We have a number of teams in the Northwest region who partner with a nurse practitioner who has an interest. And again, we've provided resources and suggested tools to help them feel more confident and engaged and comfortable in this area. We have a team that partners with Wheeling Hospital, right? So across the state. And one of the things that we've been able to do this fiscal year, and we will be doing again next fiscal year, is the state has prioritized some funding for an autism navigator in primary care. So if you've heard of Autism Navigator, if you haven't heard of it, it's a great resource. It is specifically videos of children with autism that are toddlers. And there is a course for physicians. And so if you think maybe you have someone in mind, but you're not sure, or they're not comfortable and don't feel confident, we have funding to provide slots for them to take this course. It's an 8-hour course. It's about autism in toddlers. Even if they can't take this course, there's also a free module online about autism in toddlers. But we're able to provide funding for slots for medical professionals to take that course and build those skills because, you know, there's a lot of myths and misconceptions about how early we can identify children. You know, there's still a lot of thought of, oh, we can't diagnose a child until they're 3. And we know it's happening earlier and earlier, you know, and 15 months is kind of like the lowest that we'll see happening. But in some research and some new tools, we're seeing kids even younger, potentially identified as at risk. So there aren't any specific criteria, right? Because every professional is different. But we can do some things. If you have someone who's recognizing there's a need in their community and they want to do something, we can give them the tools to help them feel more comfortable. Yeah. Great question. Thank you. What other questions do folks have? All right. Well, one thing I can share is that since COVID, right? So during the pandemic, all of our ADEP teams had to stop, you know, functioning because they couldn't do the ADOS. Since most teams started reopening, I think they've completed about 300 evaluations across the state. So as of 2022, in the summer of 2022, they've completed approximately like 300 evaluations year to date, which is good because we're trying to think about teams restarting when they have lots and lots of referrals, right? And so ADEP is, while it's designed to be part of the evaluation and assessment process, it's additional, right? So it's an enhanced evaluation that you're adding to your already existing workload and referrals. So the fact that teams have been able to prioritize this and continue it is really amazing because we've heard from some teams that, you know what, we can't keep going because we have so many referrals. And so that's been a really positive thing.
Well, thank you, Maggie. That was a great presentation.